So I thought a bit of a discussion on greater traumatic pain syndrome. There's a lot of discussion on some of the differential diagnosis. So it's fairly, in my opinion, it's fairly a straightforward condition, which you get pain on the lateral side of the hip, joint tenderness, and also other tests positive. If a patient is not responding to your rehab, one of the things I would think of is to look at the diagnosis. Is there something I'm missing here? So let's look into some of those differential diagnoses of possible reason when it's not GTPS. Obvious one is referred pain. So we're looking at, is it coming from the lumbar spine? So having a good back evaluation is really important to make sure that it's not like referred pain from the lumbar spine or the SIJ region. The second big one is referred pain from the hip pathologies. So we're talking about patients with hip OA, hip impingement, hip dysplasia. They can also have referred pain into that lateral aspect. Sometimes it can be both. So it's not uncommon, like a 52-year-old female having a little bit of OA, but also a little bit of GTPS. So sometimes they both come together. So they'll have a bit of combination of OA as well as GTPS. So see whether it's intra-articular. So do your cluster testing and the history. Questions like putting shoes and socks in the morning, stiffness after prolonged sitting. That will give you a clue whether it's more osteoarthritis. And if in doubt, you can always get an X-ray to confirm that. So second one is referred pain from the hip joint. The third condition, which is poorly recognized, especially in that sort of in the last couple of years, which you gained more interest, is a condition called proximal ITB syndrome. It's got a couple of names as TFL tendinopathy. It's a bit different, is the pain is more superior around the ASIS region. And when you scan this patient, there's a bit of thickening, usually around the ITB fascia as well as the TFL muscles there. And it's a bit different than your traditional GTPS presentation. Tends to happen more in the middle age group, more women, and more people who do running. So it's a little bit a key differential diagnosis, especially if you're dealing with the running population. Check out the condition. Maybe I'll look into a post in the future. It's proximal ITB syndrome, less, as not much recognized as GTPS. Another condition which can also have pain around that region is a condition called Meralgia Paresthetica. So this causes a little bit of neuropathic, like burning, like pain, same around the lateral region, and they're usually linked with obesity. So if they're generally having abdominal obesity or linked, I've seen this post-surgery, like post-hip arthroscopy as well, post-replacement, and some of the gynecological surgery. And they can have this sort of, that stingy, nervy-like pain, and, they can be quite tricky to pick up because they have the same area where you normally get with the GTPS. So another condition to look into is Meralgia Paresthetica, which is something which is sort of not picked up as often. Another condition which can cause a lot of distress in patient is an external snapping hip. It's something I see in dancers, people who do a lot of rotation sports. They have this clicking audible sensation and they feel like the hip is going to pop out. So they feel like the hip socket is coming out, and we show some of the tests on the course on how to diagnose the snapping hip. So you can sort of differentiate, is it snapping hip, is it intra-articular, or is it GTPS? So again, with those snapping hip, how do you manage them? So again, it's not just knowing how to identify, but also how to manage them. So that's something which we go in detail on the 2-day hip and groin course. Been done in more than 15 countries the last 9 years, and we got quite a few courses coming up. So we got London coming up, I think in June. We got Belgium in May. We got Dubai in September. Possibly I might also be doing Saudi later this year. So there's quite a few options there. So all the course links is sort of with the link down. So if you're really interested to look at more that advanced reasoning, more the end stage rehab, and also looking at the young hip, check out our course and hope to see some of you there. Thank you.